Fabior Foam is a medication used to treat certain skin conditions, such as psoriasis and acne. It is a retinoid product related to vitamin A and works by affecting skin cell growth. It should be used as part of a total skin care program for the best effect. Be sure to check the specific uses for your brand, dosage form, and strength of this medication. The recommended daily dosage and optimal timing for Fabior Foam may vary depending on the individual and their specific condition, so it's important to consult with a healthcare professional for personalized guidance. Before using Fabior Foam, make sure to read the patient information leaflet if available from your pharmacist. This medication is for use on the skin only. Wash and dry your hands before applying the medication. Apply this medication as directed by your doctor, usually once daily at bedtime. If you are using it to treat psoriasis, apply a thin film to cover only the affected areas. If you are using it to treat acne, wash and dry the affected areas and apply a thin film to cover the acne. If you are using the lotion to treat acne on the face, dot onto the chin, cheeks, nose, and forehead, then gently rub over the entire face. Use enough to cover all of the affected areas. If you are using the foam, shake the can before each use. The foam is flammable, so avoid smoking or going near an open flame while applying the medication. Do not cover, bandage, or wrap the affected areas, and do not apply this medication to normal, healthy skin. Use this medication regularly at the same time each day to get the most benefit from it. Do not use large amounts or apply this medication more often than directed, or use it for longer than prescribed. Since this drug is absorbed through the skin and may harm an unborn baby, women who are pregnant or who may become pregnant should not handle this medication. Tell your doctor if your condition does not get better or if it gets worse. Side effects of Fabior Foam may include itching, redness, irritation, burning/stinging, scaling, dry skin, or pain at the application site. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. However, you should inform your doctor immediately if you experience severe redness, irritation, or peeling. While a severe allergic reaction to this drug is rare, seek medical help right away if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. If you're in the US, you can call your doctor for medical advice about side effects, or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. Before using Fabior Foam, make sure to inform your doctor or pharmacist if you have any allergies to tazarotene, vitamin A-related drugs, or any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other issues. Be sure to discuss this with your pharmacist for more details. Before using this medication, inform your doctor or pharmacist about your medical history, especially if you have other skin conditions such as eczema, seborrheic dermatitis, sunburn, or sun sensitivity. Fabior Foam may make you more sensitive to the sun, so it's important to limit your time in the sun and avoid tanning booths and sun lamps. Make sure to use sunscreen daily and wear protective clothing when outdoors. If you experience sunburn or skin blisters/redness, inform your doctor right away. It's also recommended to wait until your skin has completely recovered from a sunburn before using this medication. Additionally, be cautious of wind or cold weather as they may also irritate the skin while using this medication. Avoid electrolysis, waxing, and chemical depilatories for hair removal on the treated areas while using Fabior Foam. Before undergoing surgery, inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Fabior Foam must not be used during pregnancy as it may harm an unborn baby. Your doctor may order a pregnancy test within 2 weeks before starting this medication. It's important to start this medication during a normal menstrual period and discuss the use of reliable forms of birth control, such as condoms, birth control pills, with your doctor. If you become pregnant or suspect you may be pregnant, inform your doctor right away. Since this drug is absorbed through the skin and may harm an unborn baby, women who are pregnant or may become pregnant should not handle this medication. It is also unknown if this drug passes into breast milk, so to avoid direct contact, breastfeeding women should not apply this medication to the nipple and areola. Be sure to consult your doctor before breastfeeding. It's important to be aware of how Fabior Foam may interact with other medications or products, as it could affect how well your treatments work or increase your risk for serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Fabior Foam include vitamin A products, hair perming solutions, other skin products with strong drying effects, skin products containing alcohol, lime, or spice, such as shaving lotions, astringents like calamine lotion, and perfume. Additionally, soaps, shampoos, and cleansers that are medicated or abrasive could also interact with Fabior Foam. Be sure to discuss any concerns or questions about potential interactions with your doctor or pharmacist before using Fabior Foam. If someone accidentally swallows Fabior Foam, it can be harmful. If the person has overdosed and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to call 911 immediately. Otherwise, contacting a poison control center right away is necessary. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of overdose may include severe redness, irritation, or peeling of the skin. It is important to seek medical help immediately if an overdose is suspected. This medication is for use on the skin only. Avoid getting the foam in your eyes, mouth, or nose, or on your lips. If it does get into any of these areas, rinse with water. Do not use on sunburned, windburned, dry, chapped, irritated, or broken skin. Do not cover the treated skin area unless your doctor tells you to. Covering the skin that is treated with Fabior Foam can increase the amount of medication your skin absorbs, which may lead to unwanted side effects. Follow your doctor's instructions. If you forget to apply a dose of Fabior Foam, you can apply it as soon as you remember. However, if it's close to the time for your next dose, it's best to just skip the missed dose and apply the next dose at the regular time. It's important not to apply extra medicine to make up for the missed dose. When it comes to storing Fabior Foam, it's important to follow the specific instructions for the brand you have. Make sure to keep it out of reach of children and pets. And when it comes to getting rid of any expired or unused product, it's best to consult with your pharmacist or local waste disposal company. It's important not to flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.